Hello all, this is Dr. Alsop again, and we will be discussing triangles in the anterior neck. Now these are constructed subdivisions based on existing anatomical structures that allow better communication regarding location of structures or injuries or pathologies among healthcare teams. So say someone says there's a laceration in the anterior cervical triangle, people will understand where that is located. So it's not so nebulous in terms of describing where injuries occur. Also, if you have not reviewed the muscle dissection supplement, please do this first, as knowing the muscles in this area is important for the boundaries of these triangles. But let's get started. Let's start with the big one before we work on the subdivisions, and this is the anterior cervical triangle. You can really see this well outlined here in this image. The boundaries of the anterior cervical triangle include medialmost is the midline, so kind of right down the middle here. Superiormost is the base or the bottom of the mandible, and lateralmost is going to be the anterior border of your sternocleidomastoid muscle, right here. So I want you to take a moment and trace these structures out on yourself. You can actually feel or palpate where all of these boundaries are on yourself. That sternocleidomastoid is that large rope-like muscle in your neck. So take a moment, pause the video if you need to, and try to kind of visualize on yourself where this is located. Once you've done that, let's break down the subdivisions of this triangle. All right, so I want to take a moment and kind of show you where those boundaries were before. So what I'm tracing right here is going to be the anterior cervical triangle. So all of these triangles that we are about to discuss are within the anterior cervical triangle. So these are 4 subdivisions of that anterior cervical triangle. We're going to start superiorly and move inferiorly, starting with the submental triangle. The boundaries for this triangle include medially, that midline that we talked about. Laterally is going to be the anterior belly of the digastric muscle. So here is the digastric, specifically that anterior belly, which you can see here. And inferiorly, the boundary is going to be the hyoid. So the hyoid bone is right here. So you can see those suprahyoid muscles here and the infrahyoid muscles down here. So those are the boundaries of this submental triangle. In terms of contents, you're going to have some suprahyoid muscles as well as some lymph nodes. Lateral to the submental triangle is the submandibular triangle, which is sometimes referred to as the digastric triangle, and is sometimes called the digastric triangle because both bellies of the digastric muscle, so the anterior, which we already showed here, so the anterior as well as the posterior bellies form the inferior boundaries. You can't see the posterior belly of the digastric very well in this view because the large submandibular gland is going to be occluding that view. The superior boundary is going to be the mandible. So as you can see, the submandibular gland is probably the major content of this triangle, as well as the facial artery and the facial vein, which you can't see particularly well here. All right, moving inferiorly, we have the other 2 triangles, which we see over here on the left side. Here is the carotid triangle, so carotid triangles right here. The boundaries of the carotid triangle include superiorly is going to be the posterior belly of the digastric, again occluded by this large submandibular gland. Laterally, the boundary will be the SCM again, so that's sternocleidomastoid muscle. And medially, we're going to have the superior belly of the omohyoid. As the name would suggest, the contents of this triangle includes the carotid sheath and its contents. You can see the common carotid artery here, the internal jugular vein here, the ansa cervicalis, specifically that superior limb there. You can't see the vagus nerve here because it's deep, but it would be considered a content of the carotid sheath. Lastly, there is the muscular triangle, which is formed medially by the midline, inferiolaterally, right along this border, by the sternocleidomastoid, and superiorlaterally by the superior belly of the omohyoid muscle. As the name of the triangle would suggest, muscles are the major contents here, specifically the infrahyoid muscles, but the deeper thyroid gland as well as the larynx would also be considered within the boundaries of this triangle, so a very important subdivision of the anterior cervical triangle. All right, so that is the anterior cervical triangle and the 4 smaller subdivisions. Take some time to review these boundaries and consider the contents. And after doing so, if you have any questions, please don't hesitate to reach out with any questions. Thank you for your time.